If someone you love suddenly became weak, dizzy, or started speaking in a way that just didn't sound like them, would you know what to do in the next 3 minutes? I'm not asking to scare you. I'm asking because those 3 minutes, the ones most families panic through, could be the very minutes that decide whether someone survives a stroke with their independence, or with a life that never looks the same again. You see, most people don't realize this. They think help only begins when the ambulance shows up. But the truth is, the very first steps, the very first reactions, start with you. Right there in the living room, in the kitchen, at the dining table. In the middle of an ordinary day that suddenly turns into a moment you'll remember forever. And I want you to picture something for a second. Imagine you're sitting with your mom or dad or a grandparent, and they suddenly look at you trying to speak, but the words come out tangled, or their hand slips from the cup they're holding, or their smile looks uneven, and in that instant your heart drops, because something is wrong, very wrong, but you're not sure what to do. That's exactly why this video matters, because every second counts, and for many seniors, those few minutes can mean the difference between recovery and lifelong disability, or worse. But here's the comforting part. You're not powerless. You're not helpless. And after today, you won't ever feel that way again in an emergency. In this video, you're going to learn the 3-minute trick every senior should do before help arrives. A trick that could buy precious time, keep the brain safer, and help emergency responders act faster the moment they arrive. You're also going to learn the 5 early warning signs that most families completely overlook. Signs that might show up long before the stroke fully hits. And yes, you'll learn the common mistakes families make in those first few moments. Mistakes that can quietly make everything worse without them even realizing it. But you won't make those mistakes. Not after today. Before we keep going, do me a favor. If you're here because you want to protect someone you love, just type, "I'm watching" in the comments. Let me know you're here for the right reasons. And if you haven't already, make sure you subscribe to Golden Years Guide. This channel is all about helping you care for your aging parents, grandparents, and the seniors in your life with confidence, clarity, and compassion. Alright, let's get into the first sign. Because once you understand it, you'll never ignore it again. Sign number 1. Sudden confusion or trouble speaking. Alright, let's get into the first sign, one that often catches families off guard because it can appear so suddenly, and so quietly, that you almost question whether you imagined it. I want you to picture this for a moment. You're sitting with your dad. Maybe he's telling you a simple story, something light, something familiar. A memory from years ago, or maybe just something that happened earlier that morning. And then, right in the middle of his sentence, he stops. His mouth moves, but the words don't come out right. Or they come out twisted, slurred, jumbled. Words that don't belong in the sentence. Words that feel out of place. Words that make you look at him a little differently, even if it's just for a second. And what's the first thing you think? He must be tired. Maybe he's just distracted. Or the classic one. He's getting older, this happens. But here's the truth you need to hold on to. Confusion or sudden trouble speaking is not a normal part of aging. Not when it appears out of nowhere. Not when the person was completely fine just a moment ago. What's actually happening in that moment is simple but serious. The brain may not be getting enough blood. And the first part of the brain that usually shows distress is the language center. The area responsible for speech, comprehension, and communication. When blood flow drops, even for a moment, the brain struggles to process language the way it normally does. And that struggle shows up as slurred speech, confused words, unfinished sentences, or a sudden inability to express simple thoughts. This is why confusion is one of the earliest red flags of a stroke. And sadly, one of the most commonly missed. Because families often assume the best. He's just forgetting things. She's probably dehydrated. She's stressed, that's all. But every minute spent assuming is a minute the brain loses oxygen. And the brain does not forgive lost time. So what can you do without causing panic, without overwhelming your loved one? Start small. Ask them gently to repeat a simple sentence. Something like, "Can you say this after me?" Not to test them, but to help you understand what's happening. Next, observe their face. Look closely, Does one side seem lower? Is their smile uneven? Listen to their speech. Does it sound different? Notice their arm movements. Are they struggling to lift or hold something? And most importantly, stay calm. Your calmness becomes their stability. If you panic, they panic. And that raises the blood pressure and increases confusion. If something like this has ever happened to your loved one, even once, hit the like button so YouTube can show this video to more people who need this information. Because this sign alone has saved lives when noticed early. And confusion isn't the only red flag. Sometimes the body sends a physical warning long before the mind does. Sign number 2, sudden weakness on one side. Now let's talk about a sign that is often brushed aside because it seems ordinary, but it's one of the strongest and earliest indicators of a stroke. Imagine this. You're helping your grandmother stand up from her chair. She reaches for you, puts her weight on your arm, and suddenly she leans heavily to one side. Not just a little wobble, but a real, noticeable tilt. Like her body suddenly decided it could only trust one half. Maybe you think, she slept wrong. Maybe her leg just fell asleep. She's been sitting too long. But here's the truth. The body rarely sends warnings without reason. When one side becomes weak, even for a moment, it usually means the motor cortex, the part of the brain that controls movement, isn't getting enough blood. And that is one of the clearest signs that a stroke may be beginning. Weakness in the arm or leg is not just a symptom. It's the brain signaling distress. It's the body saying, something is wrong. I can't move the way I normally do. But here's where many families make a dangerous mistake. They blame it on arthritis. They assume the joints are stiff. They say, just walk it out. Try moving around, you'll be fine. But telling a senior to walk it out during early stroke symptoms is one of the worst things you can do. Movement can increase strain. It can increase the risk of falling. And it does nothing to restore lost blood flow to the brain. So what should you do? Start by asking them to raise both arms. Watch carefully. Does one arm drift downward? Does one arm shake or struggle to lift? Even a small difference matters. Next, ask them to squeeze your hand. Not forcefully, just naturally. Compare the strength on both sides. Most people notice the difference instantly. These simple checks don't diagnose anything, but they help you identify when you need to take action. And listen, I'll be honest with you here. If you haven't subscribed to Golden Years Guide yet, why not? Tell me in the comments. I'm actually curious because if you care about the health of your loved ones, this is the place where you'll learn how to protect them before emergencies turn into tragedies. Now, weakness is one thing. But what if the body gives an even more subtle signal? One so easy to overlook that families almost never take seriously? Let's get into that next. Sign number 3, sudden vision problems. Now let's move into a sign that slips right past most families because it seems so innocent, so ordinary, that people blame everything except what's really happening. Picture this moment. Your loved one suddenly reaches for their glasses, wipes them, adjusts them, maybe even takes them off and puts them back on again. Then they say something like, the room looks blurry. Or, it feels like one side of the room is darker than the other. Or the one that should always catch your attention. I can't see properly, something feels off. And you might look around the room, check the lighting, glance at their glasses and say, maybe your lenses are dirty. Maybe your glasses need adjusting. It's probably just age catching up. You know how eyesight changes. But here's the truth most families don't know. Vision problems can be one of the earliest warning signs of a stroke. Because when blood flow to the brain's optic pathway is interrupted, even a little, vision becomes distorted. It can go blurry. It can double. It can go dark on one side. And these changes can show up seconds before the stroke fully hits. It's not the glasses. It's not cataracts. It's not just age. It's the brain crying for help. When the optic nerve or visual processing centers don't get enough blood, the eyes start sending distorted signals. And seniors often describe it in the simplest ways. It looks cloudy. I can't see the left side of your face. Something feels wrong with my eyes. So what can you do in that moment? A quick, simple check you can perform right away. Ask them to cover one eye, then the other. If one eye sees normally but the other looks dark, blurry, or shifted, you don't wait. You take action. Because that difference is a major red flag. And if you're sitting there thinking, more people really need to know this, comment yes below. Because you might be the reason someone else learns this in time to save their loved one. Now, let's move into a sign families almost always ignore until it's far too late. Sign number 4. Sudden severe headache or dizziness. This next sign is one people argue about all the time. Some think it's nothing, others know it can be the beginning of something dangerous. You're sitting with your loved one and out of nowhere they press their hand to their head and say, "My head is killing me." Not a normal headache, not the typical pressure or tiredness, but a sudden, intense pain that makes them stop everything they're doing. Or maybe you're walking beside them and they suddenly reach for a wall, a chair, or your arm to stay balanced. They look dizzy, unsteady, confused about why they can't keep themselves upright. These moments should never be ignored. A sudden severe headache or dizziness can mean that a blood vessel in the brain is either blocked or rupturing. It can also mean that a clot is interfering with the areas responsible for balance and coordination. And when pain shows up this suddenly, and this sharply, the body is signaling something urgent. But what do most families say? Oh, it's probably just high blood pressure. You didn't drink enough water today. You probably didn't sleep well. And while those things can cause symptoms, they usually don't strike so suddenly or powerfully. So what should you do if this happens? First, don't let them walk. Don't let them test it out. Don't encourage them to push through it. Have them sit down immediately, preferably somewhere safe and stable. Observe if they can walk in a straight line, but only if they're already standing and stable. If they can't, that's a sign you act on right away. And if you're learning something new today, if even one of these signs made you think, "I didn't know that," then hit the like button so YouTube shares this video with more families who need this information before it's too late. Because the next sign is the one people debate the most. Some swear it's nothing. Others know it's the quiet warning, the calm before the storm. Let's talk about it next. Sign number 5. Sudden numbness or tingling. You'll notice it in the smallest moment. Your loved one rubs their arm and says, "My arm feels funny," or they touch their cheek and whisper, "This side feels strange." And at first you might brush it off. You might think, maybe they slept on it wrong, maybe it's just stiffness, maybe it's nothing. But when it comes to a stroke, this is never nothing. Sudden numbness isn't random. It isn't age catching up. It's the body sending an urgent message. The nerves aren't getting the blood they need, something is going wrong. And here's the part most families don't realize. Before the body becomes weak, before the speech becomes slurred, numbness is often the very first whisper that a stroke is forming. Imagine the nerves as tiny phone lines carrying signals back and forth. When blood flow drops, even for a moment, those lines go quiet. They stop communicating. That's why your loved one might say their hand feels thick, or their face feels lazy, or their leg feels dead weight. It's not imagination. It's not overthinking. It's the earliest alarm bell. And here's where many people get it wrong. They assume it's just a bad sitting posture. Or maybe they were lying on one side too long. But the truth is simple. Sudden numbness, out of nowhere, is never normal. Not at their age. Not at any age. So what do? You calmly check for the clues a stroke might already be starting. Ask them to smile. A real smile. If one side droops even slightly, that's a sign. Then ask them to squeeze your hand. Not gently like they mean it. Feel the difference. Is one side weaker? Is the grip uneven? Does one hand feel colder, softer, or slower? These little tests might seem simple, almost too simple. But they can reveal what the body is trying to hide. And if you try these checks with someone you love, even just to be prepared, leave a quick comment saying exercise. That one word lets me know you're not just watching. You're learning how to protect your family. Now, you've seen the warning signs. You've learned the clues most people overlook. So let's shift into something even more powerful. Because in a real emergency, when symptoms appear, you don't have hours to figure things out. You don't even have 30 minutes. You have 3. So now, let's talk about the simple 3-minute trick that can make a life-changing difference before help arrives. The one thing every senior should know, and every family should do immediately. The 3-minute trick. Now, let's talk about that 3-minute trick I mentioned earlier. It's surprisingly simple. So simple that many people underestimate it. Yet it's been quietly discussed among doctors, nurses, and emergency responders for years. And the strange thing is, very few families actually know about it. This method isn't a cure. It's not a treatment. It's not something that replaces real medical care. But in those 3 critical minutes before help arrives, it can make a meaningful difference. Here's the idea behind it, explained in simple, safe, everyday language. When a stroke is forming, the brain is fighting for blood and oxygen. Panic, fear, and confusion only make it worse. Stress raises the blood pressure. And that spike can push symptoms into something even more dangerous. So the first step is calm. Not emotional calm, physical calm. You help them slow their breathing. Gentle inhales, slow exhales. Just enough to steady the body for a moment. Then you help them sit upright. Not lying flat. Not leaning to one side. Upright. This position helps keep blood flowing toward the brain instead of pooling or slowing. Think of it like giving their body the best possible chance to deliver oxygen where it's needed most. For the next 3 minutes, you focus on just a few things. Their breath, their speech, their arms, their eyes. You observe everything. Any change, any shift, any worsening, those details matter more than most people realize. When emergency responders arrive, the information you give them helps them act faster. Much faster. Now here's where the debate begins. Some people swear this 3-minute method reduces the severity of the stroke. Others say it doesn't change the outcome. But it does help emergency teams assess what's happening instantly. What do you think? I want you to be honest. Does this sound helpful? Does it sound overrated? Does it sound like something every family should know? Comment your thoughts. I want to see how divided our audience is on this. Because trust me, the discussion alone could save a life. Watching someone you love lose control of their own body is one of the most terrifying things a family can experience. To see their face droop, to hear their words twist, to watch their hand fall limp. Your heart stops. Your mind floods with fear. You feel helpless. But now, you aren't in the dark anymore. You know what to look for. This isn't about living in fear. This is about being prepared. This is about knowing the silent signs that most families miss, and stepping in with confidence instead of panic. Knowledge gives you power. Awareness gives them a fighting chance. And sometimes that's all it takes. A few seconds. A quick decision. A calm voice saying, "I know what this is. I'm here. I've got you." If you've ever seen even one of these signs in someone you care about, reach out to them today. Send a message. Make a call. Check in. One small action, one moment of care, could be the reason they're still here tomorrow. You are not powerless. You are not helpless. And seniors do not have to face these moments alone. Together, we can make their golden years safer, fuller, and more peaceful. Before you go, let's recap the signs you should never ignore. Sudden confusion. Weakness on one side. Vision changes. Severe headache or dizziness. Numbness or tingling. These symptoms are not random. They are not just aging. They are not moments to brush aside. They are warnings. And now, you know exactly what they mean. Which of these signs have you seen before? Share your story in the comments. You never know who you might help, or who might learn something because of your experience. And if this video opened your eyes, if you feel more confident, more prepared, and more aware, consider subscribing to Golden Years Guide. We make senior health simple, clear, and truly life-saving. Thank you for spending this time with me today. Stay strong, stay informed, and always, always, take care of the people who once took care of you. I'll see you in the next one.